Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Thursday, May 21st, and this is my daily briefing. We haven't had a change in numbers in Missoula County at this time, so we've still only had 41 cases to date in Missoula. 39 of those were identified by testing, and 2 were epi-linked. We've had 40 recoveries and 1 death, and we have no cases in isolation, and we're not monitoring any close contacts at this time. The state of Montana has had a total of 479 cases, up one since yesterday. There have been 16 deaths statewide. Today I want to talk about contact tracing. With the governor's phase 2 announcement, we know that in time more and more people will be in public spaces, and this could mean that a case of COVID-19 has a higher potential to come in contact with many people. As a result, we'd like to revisit contact tracing, which is a critical component of public health with a well-established and long-standing history of improving public safety. When we get a positive COVID-19, our public health nurses determine possible disease exposure and do contact tracing, or also known as contact investigation. Public health nurses work with the case to identify their close contacts, which is anyone within 6 feet of them for more than 10 minutes from 48 hours prior to their first COVID symptoms to the day of testing. After public health staff have a comprehensive list of activities and associates, they begin contacting possible close contacts, evaluating their level of risk, educating them about symptoms, and supporting them through the next steps. It's important to remember that this is a health-related investigation, and privacy and confidentiality are always a priority. To that end, the known case or the person who has COVID-19 or a known potential case remains anonymous. Close contacts are informed that through contact tracing they were identified as a possible close contact, but we never reveal the name of the person who's infected with the disease. If and when a close contact is identified, they will be required to self-quarantine for 14 days. You'll remember that 14 days is the incubation period of COVID-19. During this time, a public health nurse connects with them daily to see if they have developed symptoms. If they have, the nurse will help them connect with a testing resource. What's really cool about contact tracing is that it is a well-established practice that can be adapted to different kinds of diseases for disease response. The efficient and accurate information of close contacts, including subsequent self-quarantine and symptom monitoring, can stop disease transmission in its tracks. That being said, there are some things to keep in mind that affect our abilities to effectively contact trace while keeping overall case numbers low. We look at variables like community spread transmission, local capacity to conduct contact tracing, as well as local capacity of our healthcare infrastructure. While we have had and currently have the necessary number of public health staff to conduct contact tracing or contact investigation quickly, safely, privately, we need to continually monitor the variables mentioned earlier. Basically, as we reopen and start interacting more, when we get more cases, we could have a large number of close contacts that could be difficult to monitor, and that could strain our public health resources. One thing that we ask of the public at this time as we reopen is that it is really important to maintain social distancing whenever possible, and to try to keep track of who you're spending time with, so that if you do develop the disease, you can help our public health nurses to identify those who may have been exposed. We appreciate people who have reached out to us to volunteer as contact tracers. We're reserving our tracing efforts for nurses at this time due to the clinical nature of the work and the need for confidentiality. The health department also continues to work with the University of Montana School of Public and Community Health and other partners to continually assess our resources and cases locally so that we can adapt as needed. So that's it for my daily briefing for today. As always, you can subscribe to me on YouTube. Click that little notification bell so that you get notified when additional videos are uploaded. That's under my name, Cindy Farr, CINDYFARR. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. Check out our website for lots of information on COVID-19. That's at missoula.co/cvirus, and you can call 258-INFO if you are having any symptoms of the disease and would like to get a test done, or if you just have general questions about COVID-19 or need to find out where you might be able to get some resources. So you can call that 406-258-INFO or 406-258-4636. So until tomorrow, everyone stay healthy.